I'm Professor Luke O'Neill, and this week I'm at home. I try and work at home whenever I can. So to kick off on this week's COVID-19 update, antigen testing. We've spoken about antigen testing quite a bit, I guess, over the past few weeks. More and more evidence. It's a fantastic thing to do is the message, basically. Now, why is it so good? It's cheap. You can do it yourself. It's called point of care. But very importantly, a study just came out showing it predicts if you're infectious. Now, of course, the PCR test is the gold standard. That measures the RNA for the virus. Very sensitive. But the trouble is you can be positive in a PCR test and yet you're not infectious. There's tiny bits of virus or remnants left in your body. The PCR test picks it up and you strike as being positive. Antigen testing really correlates with infectiousness. So if you're positive in an antigen test, that means stay home because you are definitely infectious, and it could be a very useful thing to do. It has to be part of Ireland's plan coming out of this lockdown. Another really interesting topic are these new variants. Loads and loads of science. Almost on a daily basis now I'm seeing reports on these new variants. Now the question is, are they more dangerous? Is one big worry, and there's a hint the UK one might be slightly more dangerous, which means it might make you a bit sicker, but we still don't know. It's very much a work in progress. Secondly, will they escape the vaccines? Now, some really good news actually in my opinion. The vaccines will work against these variants, that's the first thing. There's evidence for that. They just might be weaker, less efficacious. Now that isn't necessarily a huge concern, because if you go from 90% efficacy down to 60%, that's still okay. And what's even more important, I guess, is if that's the case and the vaccines aren't quite so good, how quickly can the companies make new vaccines against the variant? Now Moderna and Pfizer say 6 weeks they can start making a brand new vaccine, and in fact Moderna are already making a vaccine against the South African strain. That's good, that can come in now. Two more quick aspects as well as one is, will the regulation change? Can they have to do trials again, for example? Now they're calling them bridging trials. They should be faster because they know basically all about the technology and we are popping one new piece in. So the trials should be quick. 1,000 patient trials should do it, so they should be mobilised very quickly indeed. And then secondly is which variants to pick, of course. This could be like flu eventually. Every season there's 4 or 5 new variants in flu, and they make vaccines to all 5, and the vaccine you get for flu is often against those 4 or 5 strains. So it wouldn't surprise me if in the future we see 5 or 6 vaccines in the one shot, each of them against a different variant. Now, one big worry we have, of course, is mental health, and the lockdown is huge pressure on people, and we know that. And this current one is especially worrying for us all, isn't it? The big question is, what can you do about it? And mindfulness is a big thing. And it works really well, actually. It's been shown to work in the previous lockdown. They've compared online mindfulness training versus in-person training. And guess what? It works just as well. So you can do mindfulness online now with a counsellor or a therapist to help you. So don't worry, if you really feel bad, go online, find a mindfulness coach and they can help you, and it'll work just as well as in-person training. So you can hear about these stories and more on my weekly COVID-19 update with Pat Kenny on Newstalk.